for that dilaudid. Penicillin, obviously, the antibiotics, we do know that, but it would be interesting to find out, if you could, when you're taking care of your patients, what kind of reactions did they get from all those medications. And I think that's, from all those reactions, it'd be interesting to see that. And the other thing, Kendrick, are you still there? I don't see your PowerPoint. Okay. There you are. Thank you. So the question is also, how often should we as nurses help to relieve pressure on a patient sitting in a wheelchair?
At least every 2 hours.
Well, at least every 15 minutes. We need to move them a little bit. It's about a 15-minute time frame on a wheelchair. But if the patient is understanding and cognitive, we can tell them to try to move their position about, every 15 minutes, and they can do it. But for someone who has got some cognitive deficits, that may not be as viable, because that patient may not be able to understand. So it's important that we do try to remove, even if it's a slight adjustment, it's better than no adjustment. Because if you're working and taking care of these patients, they sit for hours and hours in these chairs, right? Y'all have seen it, and you will see it continually. And so many of them, they don't know to move, and so they'll just sit there for hours. So actually, geriatrics is an excellent field to go into. So maybe if some of y'all would like to become a geriatric nurse, maybe help make some changes in geriatric care, that would be awesome. But very good. I enjoyed that presentation, and I hope the class did too. But it makes you think about, what is the role of the nurse when we walk into these nursing facilities and we're taking care of these patients. We just give them meds. And I'm sure, and I've worked in nursing homes too before, so you just have like 10, well, how many meds? There were maybe 10 at one time. And so it takes time to give all those meds. And sometimes you have to crush all those meds. And so it is just something that we don't think a whole lot of. It's like, why are we giving this? We're just going to give it because we need to get it done, because we have other patients to give meds to. So just remember, try to keep that in mind as you're going out there to become a nurse and take care of those patients, because they do depend on you to help them. So good job, group. I appreciate that. Any other questions for this group before we get started with the nutrition chapter? All right. Wow, that was great. Okay, so let's go ahead and start with the nutrition chapter, and I think that's chapter 11, right? Logan, Ashley, Michael, Maggie, Kiyomi, and Tom. Y'all ready?
Yes, we are.
All right, we're excited to learn a little bit about nutrition. It was a pretty thick chapter as far as the content is pretty deep. So excellent. Okay, looking forward to it.
Can y'all see that?
Yes, I can. Mm-hmm.
Okay, so our group's topic is nutrition and hydration, and we have Logan, Ashley, Michael, Maggie, Kiyomi, and Tom. So this is our case study, and our patient is my patient from last week, Mr. J. He is a 78-year-old white male with major diagnosis is failure-to-thrive condition. So he had a stroke last year, which happened 2 months after his wife passed away. It's really sad. Prior to the stroke, he's a really healthy old gentleman. He had no significant medical issue. He had his hypertension and hyperthyroidism were well-controlled medication, but currently his diagnoses include malnutrition, dysphagia, anemia, and depression. He lost 10 pounds over the past 4 months, which is approximately 7.5% of his body weight. He's really not a big man, and he really looks skinny in person. He had been in a generally depressed mood. His appetite has been decreasing. So on the chart, he usually eats 25 to 50% of his meal, and he drinks less than 25% of his protein supplement. Upon assessment, he appears alert and oriented, ×3. He reports no panic. His appearance is wasting, cachectic. His oral mucosa is, it can see that it's dry. His temperature is 97.3, heart rate 78, blood pressure 101/50, so that's a little bit low, possibly related to dehydration. His respiratory rate is 14 per minute. So his lab result shows a low hemoglobin level and a low iron level. Possible nursing diagnosis I have for him include nutritional deficiency related to decreased ingestion of food, as evidenced by his decreased appetite, and risk for aspiration, as evidenced by his dysphagia. And so this is our patient, Mr. J, and we're gonna discuss his problem more in the presentation about the chapter.
So nutritional needs, there is nutrition has a profound impact on health and functional capacity. Nutritional status influences one's ability to defend the body against disease, maintain anatomic and structural normality, think clearly, and possess the energy and desire to engage in social activity. So, for nutritional needs in the older adult, there are numerous age related changes. These changes are often subtle and gradual. They can progressively jeopardize the ability of older person to maintain good nutritional status, and these changes demand special nursing attention. So they have a quantity and quality of caloric needs. One of the most significant differences in nutrient requirements among people of different ages involves their caloric intake. This intake needs to be gradually decreased throughout an adult as a result of age-related changes, and a reduction in calories is recommended in the beginning of the fourth decade. So around the 40th year, adults need to start being mindful of their caloric intake. And this is because you don't move around, or people tend not to move around as much as they did in their younger years. And factors that contribute to the older person's reduced need for calories, the older body has less lean body mass and a relative increase in adipose tissue. And this adipose tissue metabolizes more slowly than the lean tissue and does not burn calories as quickly. And then their basal metabolic rate declines 2% for each decade of life after 25. So again, this is why it's more important for them, well, it's important for them to reduce their caloric intake. It contributes to weight increase when the same caloric intake of your younger years is consumed. So here we have the Harris-Benedict equation. It's called the resting energy expenditure. And basically, you use this equation based on the patient's height and weight, either in kilograms or pounds, or the height is in centimeters or inches. And you can determine how much caloric need the patients need. And this is without any exercise. So because caloric requirements and intake are often reduced in later in life, the ingested calories need to be of higher quality to ensure an adequate intake of other nutrients. And it's suggested that they limit their fat intake to less than 30% of total calories consumed. So here are the things that is recommended for older people to consume more of or adjust. So the first one is fiber, and this is particularly important in older adults' diet. It's found in foods such as oats and pectin, and it helps to lower their serum cholesterol. Fiber also improves glucose tolerance in diabetics. It prevents obesity, cardiovascular disease, and colorectal cancer. And then insoluble fibers promote good bowel activity and can be found in grains and many vegetables and fruit. Carbs are an important source of energy and fiber, but because of decreased ability to maintain a regular blood glucose level, older adults need a reduced carbohydrate intake. A high carb diet can stimulate an abnormally high release of insulin, and this can result in hypoglycemia. 1 gram of protein per kilogram of a body weight is necessary to renew body protein and protoplasm and to maintain enzyme systems. There are several protein supplements that are available and may be useful additives to the older person's diet. Calcium is required in the diet. It helps to maintain a healthy musculoskeletal system, and it promotes the proper functioning of the body's blood clotting mechanisms. And while they are taking in calcium, a good intake of vitamin D and magnesium facilitates calcium absorption. On this, we would have to caution our patient about the needed to avoid of excess calcium consumption. And then it is recommended that older adults eat at least 5 servings of fruits and vegetables, but unfortunately, only about a third of older adults consume the recommended amounts per day. So here, this was pulled straight from the book. It's table 11-2, and it's the recommended dietary allowance for people over the age of 50, and it's broken down by men versus women. Here we have the My Plate for older adults. Researchers at the United States Department of Agriculture Human Nutrition Research Center on Aging at the Tufts University have offered a modification of the USDA's My Plate to more accurately reflect the dietary needs of a person over the age of 70. So this is the modified version. And these guidelines pretty much limit foods high in trans and saturated fats, salts, and added sugars. And they emphasize whole grains and foods with high levels of vitamins and minerals per serving. Nutritional supplements. So key concepts, mineral, vitamins, and herbal supplements can be beneficial, but caution is needed to avoid adverse consequences for their misuse. Vitamin and mineral requirements for older adults are undetermined, but they are suggested that the older adult do partake in daily vitamins and minerals. Nutritional supplements can compensate for inadequate intake of nutrients and deficiencies resulting from diseases and medication effects. And niacin, riboflavin, thiamine, and vitamins B6, C, and D are the most common nutrients found to be deficient in older adults. And again, caution is needed because vitamins, minerals, and herbs, particularly in high doses, can produce adverse effects and interact with many medications. So, care of a nurse, the nursing assessment should include a review of the type and the amount of nutritional assessments used. And nurses can encourage older adults to avoid excess intake of supplements and to review the use of nutritional supplements with their healthcare providers. So this is another table from chapter 11. It's 11-3, can be found on page 145. And it's basically the risk associated with excess intake of selected vitamins and minerals. So we put in some more tables for adverse effects of extended or excessive use of selected herbs, and then also a table for herbs that have drug interactions. And then special needs of women. The reduction of fat intake to 30% or less can be beneficial in reducing the risk of heart disease in older women. From age of 64 to 74 years of age, the rate of heart disease among women equals that of men. Heart disease, cancer, and osteoporosis are among the nutrition-related conditions to which older women are susceptible. Attention to dietary requirements and reduction of fat-related risk can reduce some of these problems. Reducing alcohol intake is advisable. It's been researched that alcohol consumption also plays a role in breast cancer. And then, like I said, nearly all women are affected by some degree of osteoporosis by the time they reach their 70th decade of life, so by the age of 7. And this is because the risk of bone loss is increased by estrogen reduction, obesity, inactivity, smoking, and the excessive consumption of caffeine and alcohol. And then postmenopausal women should have a daily calcium intake of at least 1,000 milligrams. Calcium carbonate is the most cost-effective form and should be taken with a meal at doses of not more than 500 milligrams at one time to ensure optimal absorption. And then here, there are many nursing diagnoses. So you can find more on page 142, table 11-1. But based on my experience at John Knox, these were some of the ones that I kept seeing in patients. Risk for aspiration was a huge one, as well as the nutritional deficiency related to reduced ability to sense hunger sensations. I specifically saw that in my patient that I had. And then nutritional deficiencies related to limited ability to chew foods. And that's due to teeth having various degrees of erosion, abrasions of crown and root structures, and high prevalence of tooth loss.
So I'm going to talk about the hydration needs for older adults. The intracellular fluid loss in older adults results in decreased total body fluid, and water makes up to 50% or less of their body weight. The minimum fluid intake for this population should be around 1.5 liters. It's recommended by the Institute of Medicine that the fluid intake for men over the age of 50 should be 3.7 liters a day, and for women, it should be 2.7 liters a day. This is equivalent to 11 to 15 8-ounce glasses a day. Some factors that may cause older adults to consume less fluid includes reduction in the ability to feel the sensation of thirst, fear of incontinence due to their physical condition, dependence on others to obtain their fluids, lack of motivation and altered mood and cognition, and nausea, vomiting, and GI distress. Older adults are at risk for fluid volume deficit, which is when the fluids in the body are less than what is required to function normally. There are multiple ways to detect a fluid volume deficit in older adults. Some of the symptoms include increased output and reduced intake, weight loss, concentrated urine, increased pulse and weakness, increased temperature, which is important to monitor in older adults, and in their labs, there'd be an elevated creatinine and hematocrit. Some nursing interventions include performing a comprehensive assessment to detect where the deficit is coming from, keeping a record of their intake and output, monitoring vitals, urine-specific gravity, skin turgor, and weight. We also want to encourage fluids and keep them easily accessible, and provide good oral hygiene and identify those that are an increased risk for fluid volume deficit. When fluids are restricted for older adults, it can lead to fluid and electrolyte imbalances. Dehydration is especially life-threatening for older adults since they need more water and have reduced amount in their body. On the other side of dehydration is overhydration, which older adults are more sensitive to as well. It's important to assess older adults for dehydration, which has manifestations like dry tongue and concentrated urine, and for overhydration, which should show up as decreased cardio and renal function.
To promote oral health, maintaining good dental hygiene and oral health have a great impact on the overall health of the older adults. If one has pain-free and intact gum and teeth, this will promote them to intake a wider variety of food and influence nutritional status. The ability to meet nutritional requirements in late life is influenced by basic dental care throughout one's lifetime. The poor dental care, environmental influences, inappropriate nutrition, and changes in gingival tissues commonly contribute to severe tooth loss. By about the third decade of life, periodontal disease become the first cause of tooth loss. And by the age of 70, majority of people lose all of their teeth. Currently, there are a growing number of aging adults who are preserving their teeth as they grow older. Next. And in order to have healthier teeth, they need to take good care of their gum as well. So in addition to teaching methods to prevent periodontal disease, nurses must ensure that older adults and their caregivers understand and recognize the signs of periodontal disease. And these signs will consist of bleeding gums, particularly when teeth are brushed, red, swollen, painful gums. They also can have pus at the gum line when pressure is exerted. Also chronic bad breath and loosening of the teeth from the gum line. Nurses not only educate about the signs of periodontal disease, but we need to teach them what to do to improve their oral health. The older adults need to know that tooth brushing is more effective than swabs or other devices in improving gum tissues and removing soft debris from the teeth. They should avoid using lemon glycerin swabs because that dry the mucosa of the mouth and can cause tooth enamel erosion. Also, mouthwash with high alcohol content can be too harsh for the older people's mouth. So what they can do is to dilute the commercial mouthwash with water. You can mix it half mouthwash and half water. So care should be taken to not to traumatize the tissues when performing oral hygiene because they are more sensitive, fragile, and prone to irritation in the older adults. So also can teach them that loose teeth should be extracted to prevent them from being aspirated and also causing a lung abscess. Many older adults believe that having dentures eliminates the need for dental care. However, nurses must correct that misconception and encourage them to continue dental care even if they have dentures. Also, any lesion, infections, and other disease can be detected by the dentist and corrected to prevent serious complication from developing. So nurses should encourage the older adult to visit the dentist regularly. Changes in the tissue structure may affect the fittings of the dental appliances, which then require readjustment. So poor fitting dentures does not always need to be replaced. Sometimes can be lined or ensured a proper fit. So nurses need to explain to the older adults. However, the most important of all is that the dental appliances should be used and not kept in a pocket or dresser drawer. When dental appliances allow proper chewing, encouraging older people to introduce a wider variety of food into the diets. Next. And a lifetime poor dental care cannot be reversed. So therefore, geriatric dental problem need to be prevented earlier in the person's life. Even with a growing geriatric dentistry, still many people do not have access to this service or the financial means to afford dental care. So we can educate them the importance of regular dental care and oral hygiene at all ages. Let them know that aging alone does not necessitate the loss of teeth. When it is identified that an older adult has not seen a dentist within the past year, nurses should explore the reason for this and tailor a response based on the reason. For example, if an older adult admits to financial challenges in affording dental care, we can assist him or her in locating free or low-cost dental service. On the other hand, if the client state that he didn't think he still needed to visit a dentist due to his age or the wearing of dentures, nurses need to educate the client about the need for dental care throughout the lifespan as necessary. Next.
All right, so indigestion and food intolerance are common among older individuals. This could be due to decreased stomach motility, less gastric secretions, and a slow gastric emptying time. The nurse can utilize interventions for indigestion, such as eating several small meals rather than 3 large ones during morning, afternoon, and night. Doing this provides a smaller amount of food to be digested at one time, and it also helps maintain a more stable blood glucose level throughout the day. Avoiding or eliminating fried foods can also be helpful. Instead, implementing foods that are broiled, boiled, or baked can be beneficial because they are easily digested. If food intolerance exists, interventions include things such as eliminating specific foods that exacerbate their problem. Often, older adults need help identifying these problems, especially if they've eaten these certain foods through their entire lives. Sitting them up in a high Fowler's position while eating as well, and an additional 30 minutes after eating is beneficial because it facilitates that swallowing and digestion. It also increases the size of the abdominal and thoracic cavities, which provides more room for the food in the stomach. And lastly, ensuring an adequate fluid intake and activity promotes motility through the digestive tract. Anorexia. It can be related to a variety of conditions, including medication side effects, inactivity, physical illness, and age-related changes such as decreased taste and smell sensations, reduced production of leptin, which is a hormone that regulates and alters long-term food intake and energy expenditure. What Kimo was saying about that formula, how it factors their caloric intake and needs. There are also gastric changes that cause satiation with smaller volumes of food intake. And older adults to death of loved ones, loneliness, financial worries, and living with effects of chronic conditions may cause stress, anxiety, depression that could affect their appetite, such as in our patient. So since there are so many causes, the initial step in managing anorexia is to identify its cause. And depending on that cause, treatment can be implemented and tailored to the individual specific needs. Certain herbs can be useful and help stimulate appetite, such as ginger root, ginseng, gotu kola, hope I'm pronouncing that one right, and peppermint. And intake and output should be measured as well as weight. A weight loss greater than 5% within a 1 month period and 10% within a 6 month period is considered significant and requires evaluation. Dysphagia. It increases with age and can take several forms, such as transfer dysphagia, which is difficulty moving food from the mouth to the esophagus, transport dysphagia, which is down the esophagus, and delivery dysphagia, which is from the esophagus into the stomach. A careful assessment that identifies specific swallowing problems is useful in planning the best intervention for the person experiencing the dysphagia. Factors to include while assessing is the onset, types of foods that exacerbate the dysphagia, such as solids or liquids, consistent or periodic recurrence, and other symptoms related to complications such as aspiration or weight loss. As for our patient, in the case study, intervention for dysphagia include having the person sit upright whenever food or fluid is being consumed. Like I said before, it helps things go down a little bit more easily. Allowing sufficient time for eating, so just going at a slower pace and not rushing them. Ensuring that there's no residual food in their mouth before additional food is added, because we don't want to just keep packing it in there. Placing smaller portions in the mouth, discouraging the person from talking while eating, keeping suction readily available, using thickening liquids for those fluids, as well as tilting their head to the side and placing food on a particular part of the tongue can be implemented. Constipation. Some causes of constipation in older adults are things such as slower peristalsis, inactivity, side effects of drugs, and tendency to consume less fiber and fluid in the diet. Some individuals may use interventions themselves that may worsen or exacerbate their problems, such as reducing fluid intake in order to relieve their discomfort. Unfortunately, this may threaten the individual's nutrition status. Laxatives may also be used as another relief measure. This can result in diarrhea and further lead to dehydration. And if oil-based laxatives are used, fat-soluble vitamins such as A, D, K, and E can be drained from the body and lead to vitamin deficiencies. Some nursing interventions can include ensuring plenty of fluids and activity to promote peristalsis, as well as ensuring regular and adequate time allowance for the bowel movement. Fiber is also important, but should be used with care to avoid cramping and bloating. I'm sure we've all seen in the hospital sennas, often used a lot. It's an effective natural laxative, which can be consumed in tablet or tea form. And we all know there's certain foods like bananas, prunes, carrots, and oatmeal that can really get the bowels going. They should be incorporated into the diet on a regular basis to facilitate that bowel elimination and the patient is constipated. Laxatives should be considered only after all the other measures have been proven unsuccessful. But if you're going to use them, it should be used with great care.
Okay, and to finish off threats to good nutrition, we have malnutrition. So malnutrition refers to deficiencies, excesses, or imbalances in a person's intake of energy and or nutrients. So some factors contributing to older adults, as just like one some of my colleagues said earlier, we have decreased taste and smell sensations, reduced mastication capability, slower peristalsis, decreased hunger contractions, reduced gastric acid secretions, and less absorption of nutrients. Also, effects of medication can contribute to malnutrition. So anemia, anorexia, constipation, diarrhea, fluid and electrolyte disturbances, GI upset, nausea, vomiting. So as a nurse, as you know, we're almost in our last quarter, we already know that it's very important to know the medications beforehand. In other words, knowing what they do, their effects, their side effects, if they have any interactions prior to giving, so that we were aware of what can happen. And then also knowing your patient or staying with your patient or keep an eye on them to see if any of the effects follow through. Some clinical signs of malnutrition include the following. So weight loss greater than 5% in the past month or 10% in the past 6 months. Weight 10% below or 20% above ideal range. Your serum albumin level lower than 3.5. Your hemoglobin levels below 12. And your hematocrit value below 35%. So some medications that affect nutrition. So there was a lot of medications that can have an effect. So usually the effects that we would see would be like anemia, anorexia, constipation, diarrhea, fluid electrolyte disturbances. GI upset, nausea, vomiting. And like I said, a lot of these medications, we have to be educated and aware of what's going on with the medication prior to giving, so we know what to look forward in the patient. So that way, in case something does happen, where we can automatically go right to the medication, say, oh, this was the cause, or we need to change it, or we need to take certain measures to provide the proper care. So addressing nutritional status and hydration in older adults. So we need to provide an effective nutritional assessment. So with that, we need to do a very thorough nutritional assessment. So that includes you review their health history, your medications, their nutrition. Along with that, the physical examination. You inspect their hair, their skin, their skin integrity to see, how's their hydration level. Also, you would do blood work to check their H&H, and and most important, you would want to check their height and their weight to get a good basis as where they're at, and to see if they're going up, if they're going low, if they're shrinking, if they're gaining weight, losing weight, etc. Also, encouraging the social and culture aspects of food. So, I can definitely relate to this because with my family, my grandparents, they love gatherings. And in our gatherings, we have also food. We always have big, large amounts of food. So it encourages them to eat. It encourages them to be happy and be motivated and see other people eating and having fun and talking. It's going to encourage them to eat. So it is recommended to have family members bring them out into gatherings, or bring certain plates and have a little small gathering at their nursing facility or wherever they're at, where they're able to want to eat. So it is encouraged to do that. Also, you want to consider cultural variable that affect nutrition. So for example, as Asian Americans select certain hot or cold foods to restore balance. This is also something that I can relate to, because in my country, we have this thing, it's called the guapanela. I actually have it right here. And it's actually, I don't know the nutritional aspect of it, or the, what they say in Colombia about it. But when you're really sick, have a fever, cough, runny nose, cold, prior to that or during, you drink this really, really hot. And ever since I was a kid, ever since my mom was a kid, my grandparents, we drink this really, really hot, and somehow it makes you feel better. I don't know too much about it, exactly what it does, but it has to be really hot. So I was sick not too long ago, and the first thing, if I would tell my grandma, I'm sick, she's gonna tell me drink it hot. The key is to have it very, very hot. So that's something that I can relate to my grandparents. If something they were sick, they would want or request this to be really, really hot and to be taken it, during the time of their sickness. So that's something I can relate to. Last but not least, addressing services. So we have supplemental nutrition assistance program, Meals on Wheels, shopping and meal preparations assistance through volunteer organizations, home health aides for feeding assistance, congregate eating programs. There's also nowadays Instacart Ship, where you can actually shop through your phone or through the computer, and they bring it right to your door. So as a nurse, it's very important to address these services and what we have out there that could be very beneficial for them. Now time for some Jeopardy.
So with this game, obviously we don't have enough time to do the whole game of Jeopardy. So we said we'd do about 3 to 5 questions, whatever you prefer, Professor Stevenson.
Oh, absolutely. I'm excited. Yes, the 3 to 5 is great.
Okay.
And then I'll have to play it later.
And then how it'll go, it's kind of Jeopardy-ish. So basically you pick the category and the amount of points that you want. And then you don't have to worry about saying like what is or who is or anything like that. You just have to answer the question.
All right. Well, we need some participants from your peers there. Absolutely. Okay, class, I'm getting excited here. I can't wait to see behind the door here.
What's the hydration needs for 500?
She's going big. Okay.
Oh, yeah.
So factors that may cause older adults to consume less fluid. There's multiple, so if you can think of one or two, that's fine.
Increased fat, less muscle.
Logan, you can reveal the answer.
I forgot. Oh, spacebar.
So again, these are all the factors that may cause an older adult to consume less fluid. And these are pulled straight from our PowerPoint.
Threats to good nutrition for 200.
Related to a variety of conditions, including medication side effects, inactivity, physical illness, or age-related changes such as decreased taste and smell sensations, reduced production of the hormone leptin, and gastric changes that cause satiation with smaller volumes of food intake.
Decreased food intake.
I think it's the disease it's asking for. Yeah.
Disease.
Or the condition. It's related to a variety of conditions. So
Malnutrition. Anorexia. All of them.
All of the above.
anorexia thing.
Well, great job. Yeah, good.
Let's do an easy one. What's the minimal required fluid intake?
1.5 liters.
Good job. Let's do one more. Anybody want to pick?
Do big money.
Nursing diagnoses for 300.
Big money. 300? Okay.
Sure.
Maintain a strict record of intake and output. Closely monitor vital signs, urine-specific gravity, skin turgor, mental status. These are nursing interventions to improve what condition in an older adult client?
Dehydration.
I would say so. Alrighty.
Well, thank you all for participating.
Well, class, what do y'all think about this presentation on nutrition?
It's very interesting because we have a lot of relatives that are elderly, and you could kind of compare what they should be doing and what they're kind of not doing. And then you could give them advice too, because my dad, he doesn't drink enough water, and they're more prone to dehydration, less water reserves, and it's good to know the nutrition.
It is good to know, and I need to follow our own rules, right? For myself, I need to be drinking more water and things like that. All right, well done. I got tons of things to talk about real quick before we take our break, but I'll make this fast as possible. Group, you did a really nice job. It was very detailed, very in-depth, and clearly and concise. I like that because you have your condition, you have your nursing interventions, and NCLEX is about nursing interventions, right? What do we do to take care of a patient? So those are very, very important. Just a couple of other things. For your patient that you used as an example, he had a stroke 2 months after the death of the spouse. How is that related to what's happening to him now nutritionally? You actually kind of mentioned it in your presentation.
So the stress would, for the anorexia, it would kind of give way for the anorexia and the dysphagia for the stroke, especially.
Absolutely, yeah. We see that it's pretty, it's kind of common that when somebody has lived together for such a long time and then one of their spouses die, then that failure to thrive can become a major problem. If that's all they've really known for 60 years or 50 years. So that was good that you brought. This patient is an excellent example for nutritional status. And other than dysphagia, what other stroke deficits did he have, if anything? And of course, he used failure to thrive. But was there anything else? Could he walk? Could talk? Anything like that?
So he can talk. He's slow to react, but he can talk. He cannot walk. He's on wheelchair, but he other than that, other than dysphagia, he's his I'll say he recovered not too bad from his stroke. He still have
Hear me? Oh, there you go. I hear you again.
The nurse says that he still have some life side weakness, but when we do our assessment, it's not too evident.
Okay. All right.
And
so
in
they brought him
addition
in
to all
basically.
of that, he also had the generalized depression that could be from losing that spouse, or that could be from his health declining.
That's a good point you make, Kiyomi. Absolutely could be a number of things. And he obviously had dysphagia. His blood pressure you mentioned was 101/50, and he's on some medications for hypertension. What is the relationship to that blood pressure and those meds? And I can't remember how many meds he had for hypertension.
I didn't put the meds in here, but currently for hypertension, he only had LASIK because his blood pressure is pretty controlled, and I think his blood pressure is low also because he's dehydrated.
Okay, that's a good point. He could be dehydrated. So he's only got LASIK for hypertension?
Yes, but I didn't list all the meds
Okay.
on in the case, but he had a lot.
Okay, so he has a lot of different ones. So think about when you're doing your medication administration for this patient, we have to really monitor that blood pressure. It's 101/50. So we have to really focus on, if we're going to give them all these blood pressure medicines and that LASIK, we have to think about safety. Of course, that was on the last presentation, but you have to think about that. If we're going to give all these meds, and it could drop his blood pressure even much lower than 101/50. So that was good that you brought that up. The grapefruit picture, I loved it. You had the nutritional y'all had great pictures. You remember seeing the grapefruit as a big old fat grape juice up there, What is important to remember about grapefruit?
That it interacts with certain medications, like it slows it stops the effectiveness of the medication.
Absolutely. We're going to look at that in pharmacology in 449 in senior seminar, because for the most part, you won't see grapefruit or grapefruit juices in the hospital because of the interactions because of those medications. But so that was really interesting that a grapefruit was up there. I thought that was kind of cool. All right. I told you, and the moving graph was kind of cute too. The lady drinking water, I thought that was good. Lemon glycerin swabs, I'm glad you brought that out as well. We've used those in all my career of nursing, and I've been in nursing a long time. We used to use those routinely all the time. And until they did research and did some evidence-based practice, we did not realize that glycerin swab was drying the mouth out and making the mouth even worse than if they had not even had any. So I'm glad you mentioned that lemon glycerin swabs. Great nursing interventions, I've mentioned that. I do have a question, maybe the class could answer this. You noticed that when you were talking about malnutrition, you talked about 20% above ideal range. And of course, there was a lower range. why would we say a patient could be malnourished if they're 20% above the ideal range?
Does it go back to the part that I covered with the caloric intakes where it has to be, you could be eating, but it's not proper or it's not the right things that you're intaking?
Absolutely. It could be way too many carbs or things that doesn't have a lot of nutritional value, packaged products. So the patient might be taking in the calories that they need, uh, but um, but their ideal range is up 20% or above. They're just not getting the proper nutrition. It's a good point. I like that. Just wanted to make sure y'all understood that why there's a low range and above another range, 20%. So there's really why. And just to remind you, everybody knows that eating is a social experience, isn't it? And we have seen with COVID where many of our older adults who have to be at home, they might get Meals on Wheels, but a lot of times they'll have to eat alone because they weren't able to get out, although things are getting better, I will say. And so that really can decrease the amount of interaction with other people and maybe don't want to eat as much. So that's something that now, as you are now going in to nursing and going out to transition, look for patients who have been affected by COVID or having to stay home, particularly our older adults, and find out if they had family that they were eating with. It'd be interesting to see if they had lost weight during that time frame while they were like the year lockdown, basically, is what we call it. So that would be very interesting to kind of check with your patient. All right. Again, it was really good. I love the game. I have one last question, and that is for Michael. Michael, what was the name of what was the name of that drink you were talking about?
So it's called agua panela. So it translates into water sugar cane because panela is sugar. So it's a water sugar cane. And there's some people that are from the same country as me and they're familiar with it. And they can also tell you, I can almost guarantee you that they do the same remedy because it's very common for us to use it when we're sick. So yeah, it's called panela. So it's just like a sugar cane. And
Oh, you can buy that, right?
Yeah, they actually sell it in Publixes. Some Publixes, depending like if there's a really Hispanic community around, then you'll have more like Hispanic products. So some Publixes do have it, some don't. But if not, I mean, you can go to any Hispanic store and they'll have it for sure.
Well, I personally wanted to kind of go find it and to kind of try it out. I mean, it sounds like a good idea.
Yeah, and it's crazy because when you drink it, you feel the warmness, and it's like it kind of. Back then, they used to say like drink 2 shots of rum and then wrap yourself in a blanket.
Yeah.
It's almost kind of like the same thing when I do it. When ever since I drink, you get that warm feeling, and then you get like really hot, and then you begin to sweat, and then usually, I mean, since I was little, I mean, I would feel really good like the next couple of days. Like I would drink it consistently, and I'll feel great. I'd eventually come back to normal. So it's and it's for my grandparents, my great grandparents. So it's come down the line, and I'm sure my other friends that from there, I mean, I guarantee they use it too.
Well, how interesting. Could you put in the chat how to spell it?
Absolutely.
Yeah, because I know you could tell me over remote, but is it better for maybe some other students might be interested in it? Okay. All right, class, that was a very interesting, a very exciting presentation, and I know you're all looking forward to your break now, unless there's any questions. All right, it's 10:11, 11, 12, 13, 14. Come back about 10:25.